Hello, everyone, and thank you for tuning in to IFFGD's Research Award Winners series titled Where Are They Now? This program was designed not only to acknowledge this year as being IFFGD's 30th anniversary, but it is also designed for us to be able to catch up with some of our past Research Award winners. So today we have the pleasure of speaking with Dr. Van Tilburg, who was our 2007 IFFGD Research Award winner for Junior Investigator in Pediatrics, and she was also our 2008 Research Grant recipient to study functional GI disorders a little bit deeper. So thank you so much for joining us today, Dr. Van Tilburg.
Thank you for inviting me. I'm excited to be here. IFFGD is close to my heart.
Oh, thank you. So can you just give us a little bit and tell us a little bit about yourself and just a bit of a background about your current career focus?
Sure. So I am a psychologist by training, but I only do research. I don't practice, which is always confusing to people. But I've been in the functional GI world for a long time. I originally started at University of North Carolina with Bill Whitehead, and Dr. Osman was there too. So it almost immediately got connected with IFFGD. And when I started with Bill Whitehead, I discovered that science was really growing concerning functional gastrointestinal disorders, specifically irritable bowel syndrome at that time for adults, but there was very little done on children. And there was some data suggesting that if you intervene with children, you can prevent lifelong problems. So many of these children will go on and develop IBS and if you have abdominal pain in childhood, but when you have it as an adult, there's really no chance for complete recovery, right? Complete symptom-free. There might be symptom-free episodes, but not to be completely symptom-free. And with children, there was all this evidence that within 4 to 5 years, actually 2/3 of children would be symptom-free. And so I thought, what a great hole right there, gap of our knowledge to jump into. Because if we can prevent IBS in adults by targeting abdominal pain in children, and that's just really wonderful. So that's been my focus throughout my career. I'm still focusing on children, doing a lot of work on developing psychosocial treatments like cognitive behavioral therapy and hypnosis for children with abdominal pain. Doing that increasingly through remote options, like we've done studies by phone, we're developing apps. I might even get involved in a virtual reality study. So increasingly sort of recognizing this new world order where you can't see a therapist all the time in person, right? And then in addition, I've done a lot of work, and a lot of this work that I just said to you too, but a lot of work with Rona Levy, who has focused on parent-child interaction. And so I have done a lot of parent-child interaction studies. And together with Rona Levy, we actually conducted the first study where we intervened with parents. So we didn't give the treatment to the children. We actually taught the parents how to manage their child's pain better at home. And that was incredibly helpful. So I'm excited about that type of work. The grant that we did was on a whole different topic. It was a mitochondrial DNA, which is, we all have 2 different types of DNA in our body. Most people don't realize that. But we have our regular genes that you think about. You get half from your mom and your dad. But the mitochondrial DNA is a very small little circular gene that you get only 38 genes on there. It's in your mitochondria. And your mitochondria, if you remember that from school, are the powerhouses from your cell. That's where all the energy is generated for your cells. And we found that some mitochondrial DNA involvement in chronic pain and IBS specifically. So that was really exciting work to then generate future funding and publications. I think just last year, we published a paper on mitochondrial DNA in chronic pain. So has helped me a lot to receive the supporting funding from IFFGD.
Oh, well, it sounds like you're definitely in a broad area of array of things, and that's awesome, especially when you think about doing so much research in those areas to help advance the field of GI, especially in pediatrics, where we know there's a lot of gap needs there. So I know you've talked a little bit about some of these studies that you are involved in, but what are some current research studies that you are taking place in your lab today?
So I'm keep on collaborating with Dr. Levy, and currently we have a study in collaboration also with Rob Schulman at University of Baylor, where we are comparing a dietary therapy called FODMAP to cognitive behavioral therapy in children with abdominal pain, and trying to predict what factors would tell us who will be most likely to respond to one or the other. Because still currently with our treatments, we're very much, well, let's hit this one with you, see if it works. If it doesn't work, let's try another one until we find something that sticks and works for you, or hopefully multiple things that stick and work for you. But it's very much on a trial and error basis. We cannot really predict who will respond best to what type of treatment. So I'm excited to do that type of work with this group and continuing the collaborations we've had for a long time.
Yeah, it's like,
sorry.
I was just saying, it's just targeted treatment. That sounds very interesting, and it sounds very helpful, especially for a patient community. But go ahead.
Yeah. So I'm also working with Dr. Hollier, John Hollier. It's also at Baylor, and he received PK awards to look at developing an app for functional abdominal pain in children. And he's using some of my earlier work on hypnosis, which was a home treatment, which back then was kind of strange. It wasn't what we were thinking about. We actually still tested it on CDs and CD players, which you probably can't even buy anymore at this point. But he's taking that type of treatment and putting it into an app. And so I'm excited about that, and involved in some other mobile health applications, etc. Some other parenting type of studies that I've been involved in. So yeah, continuing lots of lines of work that I've been doing so far.
Yeah, and definitely in pediatrics, it is important to bring in the parent because, as we know, they're the caregiver for some of these children. So that's really interesting that you're bringing in the parents to at least practice and help them know how to better help their children at home. And extremely important, especially now. I mean, we're all home right now. Sounds like a lot of your studies are very forward thinking and trying to figure out how we can do some of these things if patients can't come to the office. So what are some things, part of these studies that you are involved in that you might hope to get a better understanding about in order to treat patients, especially children with gastrointestinal disorders?
I think it very much links in with what I've already said. We want to know when we need to prescribe certain treatments to children, because we know, okay, cognitive behavioral therapy is very helpful for a lot of children, but not for all of them. Diets are very helpful, but not for all of them. Medications are helpful, but not for all of them. And so we need to figure out, do a better job at, telling, instead of asking parents to and children to go through treatment for a month or 2 months or however long is needed for that treatment, and then you sort of delay having that symptom reduction. I think that's really, really important. And in addition, I am really committed to helping the helpers. With any disease, it doesn't matter what it is, whether it's a functional GI disease or an organic disease. You think about inflammatory bowel syndrome, for example. It doesn't really matter what kind of disease it is. Diabetes. Parents see their children every single day. A physician or another healthcare provider might see them every couple of months at the most, usually, right? So they might do a lot of great work and educate them and help them, etc. But the parents have to make decisions, healthcare decisions about their children every single day. And if we can inform parents better, also listen to parents on what they would like to know from us, in order to be able to help their children better, I think that would be a really great gift. Sometimes I'm on the phone for hours with a parent who's had a child, for example, with constipation for a really long time, has not been able to figure something out. And I always tell them, well, I'm not a doctor, I can't give you any medical advice, but I can tell you about functional constipation and what the mechanism is behind it. And if I just tell them about that, and usually a world opens to them. There's just, we need to do a much better job about preparing physicians outside of this specialty area to deal with these patients, because I think there's just a really big lack of that out there to And part of providing these therapies online and through mobile devices, etc., is also to try to bring it to more people. I know that there are very few psychologists who know how to deliver cognitive behavioral therapy to children. And a lot of times parents will say, well, we've already tried that and it didn't work. But actually, the therapy was focused on the wrong thing. It was focused on reduce your stress, reduce your worrying, reduce your anxiety. And that's not what's helpful. Of course, the children are stressed out and they're worried because they have pain, but you take the pain away, the worry and the stress goes away. So you really need to focus on the pain, like how does the pain affect you, and how can we make you live a fuller life, even when you might have pain occasionally, right? And so I know that there are not many therapists out there who do that type of treatment, and by developing these treatments that are more mobile health treatments, we can hopefully get it in more homes.
Yeah, and like we know, it takes a village really to help these patients and to help any patient with any chronic disease in general. And just bringing that all together, I think it's very important in order for it to benefit and to help the quality of life for each one of the patients. So out of all of the acknowledgments that you have received, what are some, since the IFFGD award, what are some acknowledgments that you've received here recently, or just maybe since 2008?
Oh my goodness, do you have a little bit of time? I've had lots of opportunities in my own career, certainly more grant funding, lots of publications. But the ones that I treasure the most are things like being able to contribute to educational materials for patients and parents, advising the FDA on drug trials, the EMAs, the European FDA variant. I've contributed here in North Carolina to referral guidelines for GI patients. Lots of those opportunities where you're really through systematic sort of changes make an impact on children's health and happiness and well-being. And of course, one of the big things for me also was to be part of the Rome Foundation. The Rome Foundation develops the clinical guidelines for functional gastrointestinal disorders. And so in 2016, when the updated guidelines came out, I was part of that committee, and that was incredibly valuable work. It was hard, but it was just incredibly valuable, because that is the thing that every single physician and every single healthcare provider will take with them in their office. I have a student currently who is in PA school, physician assistant, and she just texted me today and she said, hey, we're learning about the Rome 4 criteria. And so those are the things that I treasure the most, because they reach the patient. So yeah, a publication for me is great for me, but it doesn't necessarily reach the patient. So that's something I'm really excited about. And in addition, I've started to become really active on social media. And so that gives me a direct impact where I can talk about parents, about child health, about how to address chronic pain. There's lots of medical providers on there, psychologists on there. And so I can not only reach parents, but the healthcare providers as well. And it's been incredible to find that community for me too, because I'm learning all the time. But it's incredible to have that outreach to patients. And I always say, my publication maybe reaches a couple of people, maybe 10, 20 people in my field, but my post on social media will reach 1 million or 2 million people. And so that's, I think, it's impactful, and I'm having fun doing it.
Yeah, I mean, I know every time that we've worked with you on anything, you've always put the patient voice and the patient perspective first. So I'm just so glad that we're able to highlight some of the things that you are very passionate about, which is to best help the patient and the patient community, and to help educate the general public about how these disorders really do affect those in the community.
Yep.
So, and part of that, what do you mostly enjoy about being a researcher?
Being a researcher, most people think if you're a professor, you're sitting somewhere, you have all these books to read, and you think all day, and that's kind of the image people have in their minds. Yeah. It's actually not true at all. It's farthest away from that. Whenever I have time to actually sit and think, I don't know when that is, right before I go to bed, maybe. What I enjoy most about research is that two things. First of all, it is a constant solving of puzzles. There's always a tiny little thing that you need to do every single time, no matter how much you plan, something will go wrong or will go differently than you expected. And so I always tell my students, if they thinking about going into research, I'm like, do you like solving puzzles? If you like solving puzzles, you're going to love research, because it is, solving a little puzzle every day. The other part that I really, really like about research is that, imagine when you're doing research, you're not just going in and, let's say it's school and you have to learn something. Somebody has already thought about it, done it for you. You can do a science experiment in chemistry class, but somebody has already done it. You're just sort of repeating it. For research at this level, you're at the edge of knowledge. That means that not only do I not know or cannot predict what I'll find, I also usually don't have the tools, to know how to get to the knowledge. And so you have to function in a very strange environment where nothing is known. Like, there's almost nothing is known, but it's also very exciting because you can just go out and say, I'm interested in mitochondrial DNA today. I'm not an expert, but guess what? Nobody else is, or there are very few people who are, and nobody else in a functional GI is. So I'm going to figure this out, and I'm going to solve all the problems to be able to even measure something. So it's an exciting, for me, that's really exciting about research. And then I think the last thing, this, I've already said it before, research is, to me, always something that directly or indirectly needs to touch patients' lives in some way. So I'm not doing research just because I love it, but it really feels I'm making a difference. Like, a clinician makes difference in so many people's lives. But if you do the right study and you discover something new, it gets spread across, and so many people start using it. Like, my hypnotherapy scripts that I've developed are available for free to people with the right training, and I already have hundreds of people all across the world using this. And that's like, I couldn't do that as a clinician. So it's a nice way to know that you're making an impact in so many people's lives indirectly through changing practice. So yeah.
And it's like all the questions that any patient can have, you have the opportunity to just investigate that so that you can potentially help them and solve and, I guess, provide answers to whatever questions that these patients do have. So, and knowing that there's obviously a lot of questions in general that everyone has about GI disorders, what do you see as being some of the biggest gap needs? And how do you see the future of research fulfilling some of those gap needs, particularly in the pediatric community?
So in the pediatric community, we just need to do a lot of catch up. There's so much studied and so much known about, treatments, causes, pathophysiology within adults that we just don't have in children. For example, the FODMAP diet I talked about before, there's multiple trials, large trials in adults. There isn't one in kids so far. So we have a lot of catch up to do. That's one of the main things. I think the other thing is, and I'm not sure it's going to be solved in my lifetime, that's where you bump up at the edge of knowledge and you go, we don't have the tools currently, but maybe, at some point when you have the tools, that's when you can start studying that. Like, I've been through many of these variations of all of a sudden we could look at people's brains because we had fMRIs that we didn't have before. And now we could look at people's genes because now we had the methods to do that. And then we could look at people microbiota because we didn't have the methods before. And now all of a sudden that's a big field. And one of the things that I think is really going to be advancing our field a lot once we have the strategies and the methods to do it and to measure it, is that I see functional GI disorders or disordered brain gut axis as a system disorder. It's not just one thing. Oh, you have high blood pressure, let me treat the high blood pressure. No, it's multiple things, multiple factors in people's lives and in their bodies and in their psychosocial environment. And we know that by targeting each one of them, we can help people. But wouldn't it be cool if we can really study that? If we can really say, hey, if you have a combination of this, this, and this, then you'll get towards being symptomatic. But if you take one of these out, you won't. Or if you change one of those, you'll. Anyway, it gets to sort of again, this personalized medicine, but studying the whole system together instead of one factor, which is what we're usually doing now. Let's look at your brain, then let's look at your gut. Now let's look at your psychosocial environment. We're really truly looking at all of them together. I think that would be really important, and I love to see that in my lifetime to happen, but we'll see.
Yeah, and I mean, I think as you know, from being in the field, there's many different aspects to a patient who might have functional abdominal pain syndrome. Like there's other things that may be involved in that. So I think just how what you're saying, as far as just studying the variety of aspects that can influence someone's symptoms, that's awesome to know that that's at least in the minds of researchers in order for that part of the field to be advanced. So I'm extremely excited.
Yeah, me too. And I'm sort of hoping this is nothing special about functional gastrointestinal disorders. You go to somebody with inflammatory bowel disease, somebody with reflux, somebody with, it doesn't matter, diabetes, heart disease. It is exactly the same thing. We just tend to only focus on the biology because we go, oh, right, that's right in front of us. We have a drug for this, so let's treat only this. It's not optimal for those patients either, but that's how our medical system sort of is set up to do. We can do that with people with functional GI disorders. And so we have to hit these other targets, but it informs then treatment for other disorders. So I actually think we are trend setting to take it to other diseases. And what I'm really excited about, I hope, is long COVID. I'm not excited about that people have long COVID, but I'm excited about that it puts these types of symptoms on the map that you can have. We often know inflammatory bowel disease or IBS happens after a food poisoning, for example. And yes, all your immune parameters go down to below where we say you have an infection, although it's still a little bit active. It's not like highly active anymore, but people continue to have incredible symptoms. And I would say before COVID, all of those areas were incredibly underfunded that actually looked at what is happening with patients when this is happening and how can we solve this. I'm kind of hoping long COVID puts this on the map, and now we can get more funding so that all of these other disorders where that's true, including functional gastrointestinal, fibromyalgia, lots of other ones, we hopefully will get more information for them too, and it helps us along the way. I often tell people, I say, gosh, if we only had funded these fields better, we would have the solution to long COVID by now. Now we don't, so it shows you, sometimes it's good to invest in a certain field, but yeah, I'm hopeful. I don't know if it will happen, but I'm hopeful that long COVID will give us the stimulus and understanding and funding and understanding what's going on and developing our treatments that will benefit all of us, and especially patients like functional gastrointestinal patients.
Yeah, if there's one positive that we have to take from everything going on right now, that would be one for sure. It's just increasing the funding in that area,
Yeah.
and to provide more awareness and generalize the public knowledge around GI disorders and any chronic illness, really.
Yeah.
So, thank you, everyone who has tuned in to IFFGD's Research Award Winner series titled Where Are They Now?, where we've had the pleasure of speaking with Dr. Van Tilburg today and to understand just a little bit about her journey in research. So thank you so much for joining us.
Absolutely. And thank you for all the good work you're doing and continue to do in the future.
Oh, the thanks and the honor should all go to you because you are the one in the field and really advancing the field of GI. So thank you, and thank you to any other of the researchers that you are working with as well to better understand some of these GI conditions that affect the adult and children population.